A woman who battled blood cancer for years without success finally halted the disease with turmeric, it has been reported. Dianique Ferguson is now leading a normal life after giving up on grueling treatments that failed to stop it. Doctors say her case is the first recorded instance in which a patient has recovered by using the spice after stopping conventional medical treatments. With her myeloma spreading rapidly after 3 rounds of chemotherapy and 4 stem cell transplants, the 67-year-old began taking 8 grams of curcumin a day, one of the main compounds in turmeric. The cancer, which has an average survival of just over 5 years, was causing increasing back pain and she had already had a second relapse. But it stabilized after Mrs. Ferguson, from North London, came across the remedy on the internet in 2011 and decided to try it as a last resort. The tablets are expensive, £50 for 10 days, but as kitchen turmeric contains just 2% curcumin, it would be impossible to eat enough to get the same dose. Mrs. Ferguson, who was first diagnosed in 2007, continues to take curcumin without further treatment and her cancer cell count is negligible. Her doctors, from Barts Health NHS Trust in London, wrote in the British Medical Journal Case Reports, "To the best of our knowledge, this is the first report in which curcumin has demonstrated an objective response in progressive disease in the absence of conventional treatment." The experts, led by Dr. Abbas Saidi, said some myeloma patients took dietary supplements alongside conventional treatment but few, if any, used dietary supplementation as an alternative to standard anti-myeloma therapy. But they added, in the absence of further anti-myeloma treatment the patient plateaued and has remained stable for the past 5 years with good quality of life. Since the turn of the century, more than 50 studies have tested curcumin, the pigment in turmeric that gives it that bright yellow color. They suggest the spice can protect against several cancers, as well as Alzheimer's, heart disease and depression. It has also been shown to help speed recovery after surgery and effectively treat arthritis. But although it is widely used in Eastern medicine, and has been studied for its anti-inflammatory and antiseptic effects, curcumin is not widely prescribed because it has never been tested in large-scale trials. The doctors wrote that the biological activity of curcumin is indeed remarkable, including its anti-proliferative effects in a wide variety of tumor cells. But Professor Jamie Kavanagh, one of the authors of the paper, stressed it may not work for all patients. He said, "A lot of my patients take curcumin at different stages of their treatment. I don't object to it. Dianique's is the best response I have observed and it is clear-cut because we had stopped all other treatment." Mrs. Ferguson, who runs Hidden Art, a not-for-profit business helping artists market their work, is frustrated doctors cannot recommend the spice and wants more research carried out. She said, "I hope my story will lead to more people finding out about the amazing health benefits of curcumin."